My name's John Jellis, and I'm now a retired orthopedic surgeon. But the thing I want to talk about today is the FlySpec project, which started in a very small way in about 1982. I was head of the orthopedic unit at the University Hospital in Lusaka, Zambia at that point, and I was a private pilot and had a small aircraft. And from the work of the teaching hospital in the capital city, it was pretty obvious that we were dealing with patients within a fairly small radius.
My name is Goran Jovic. I'm a plastic and reconstructive surgeon from former Yugoslavia. I came to Zambia in 1992 for the first time. 94, I approached a very strange Englishman who was flying out into rural areas with his own plane. I said, "Professor Jellis, may I join you? I think I might help delivering the service in a remote area." And I understand now what means flying alone in the aircraft. He said, "Okay, come, chap. You are very much welcome." So in 1994, I first started flying with him, and as he said, it was very low budget.
FlySpec is absolutely an open-ended project. We have 2 aircraft, we have 5 pilots we can call upon, and we have 7 orthopedic surgeons and 20 postgraduate students who we can call upon. Really, the only limiting factor is money. The need is enormous. We visit 17 different hospitals at the moment, but we could be visiting twice that number.
You can imagine a person coming 1,200 kilometers, spending 3 or 4 days, 2 months income for 2 people to come to Lusaka, and I say, "Sorry, come to see me in March." Most likely that patient will not come back again.
Travelling is very expensive, and most of the people in the rural areas are extremely poor, living on less than $2 a day. So they can't come to the teaching hospital. It's far more economic to take orthopedic surgeons out to these hospitals.
The value of going out and help patients at their own place, maybe half a day trip instead of 3 days trip. They can stay in a familiar area.
There's a great variety of pathology, and one really doesn't know what you're going to encounter until you get there. We take our postgraduate students out with us. It's a tremendous experience for them to be at the front line, as you might say, of orthopedics. The patients are not already nicely put in bed in the teaching hospital. You're not doing teaching ward rounds with them, but they get to see the cases from the beginning and have personal teaching on that patient before, during and after operation. So FlySpec is already part of the postgraduate teaching program.
Professor Jellis, he trained a number of orthopedic surgeons. In 23 years of my work in Zambia, only recently, actually last year, 2 doctors approached me who wanted to be a plastic surgeon. The greatest challenge is to get these 2 to replace me, to continue the work long way after I stop working and practicing, which I hope it will take at least 10 to 15 years more, depending on the health and financial support.
My name is Dennis Sakala, Dr. Dennis Sakala. I am an orthopedic senior registrar, so I'm heading a orthopedic unit.
My name is Dr. James Mulenga, currently pursuing my studies in orthopedics and trauma at the University Teaching Hospital.
My name is Colin West. I am a postgraduate student in orthopedic surgery in my second year, going into my third year at the University Teaching Hospital.
I was just in the last weekend, I traveled to Kasama for 3 days, in which we had carried out at least about 25 cases. I'm traveling again this week to Monze, in which I'm accompanying another consultant. And so this situation where I have to be away from home and my family still needs me, but I feel motivated that despite my family needing me in that situation, these children also need me more of my care to them, and that gives me the drive to still go on and participate in FlySpec.
Kasama alone did about 24 cases, and then in my case in Mbala, I did 22 operations, and I had to operate starting from 8 hours on Friday and finished my operations on Saturday at 06 hours in the morning. So, and having done
You are mad.
having done that, I still did not finish the list that I had intended to finish.
There's been times when it has been tiring. We operate late into the night, sometimes as late as 10 p.m., sometimes 11 p.m. at night, and you're really exhausted. And at that time you ask yourself, what am I doing here at this odd hour? But most of the times when you see the operations afterwards, and the smiles on the patients' faces, it's very rewarding, and actually it encourages you to want to actually do more surgery the next day. So I think the work that we do and the help that we give the people is enough motivation to keep me going.
Now, what happens if you don't do this sort of work? These patients simply fade away. In these poor rural populations, if you can't work, which is basically subsistence farming, if you can't dig the fields and do your share of the work, then you can't exist. So the prevention of disability is one of the main things in this sort of population which one is trying to do, to stop people becoming crippled. Because if they are unable to work, there is no benefit for them, there is no state money.
I've operated over the years close to 11,000 cases, not patients but surgeries, for almost 11,000 in 23 years now. After operating on the patient once or twice, if they are both legs, you come 6 months later or a year later, patient comes for review, greeting you, walking towards you. Before, they were crawling, or if they were lucky to have a wheelchair.
Patients who do not have access to quality orthopedic care generally end up with deformities that alter the quality of life. And what I have personally taken note of on the many visits that I've been to numerous areas in the country has been the fact that the patients that we've attended to, in most cases, have had improved quality of life as a result of the intervention that we've provided.
One of my major hopes for the future is that as I graduate from my training, I should be one of those that take up the mantle from the senior colleagues. If possible, I think I would want to contribute more by taking up one of the sites that FlySpec visits, and if possible, if well funded, then that would be have more frequent visits to that site, and thus be able to help out more of the patients that need this specialist care. So I would want to thank the supporters of FlySpec, that includes Wings of Hope, who've been very much involved in the support of FlySpec.
Thank you so very much for watching the interview.